Doctor, we'll move on to the next question.
Hi ma'am, I'm Manju doing my NC at SNG's college. Nowadays most of the people are suffering from tooth decaying problem. I just want to know how we can able to prevent this tooth decaying.
We can prevent tooth decay. First of all, you should have to consult the dental surgeon each 6 months. Then other thing is proper brushing, then proper cleaning of the teeth. Then we should have to reduce the intake of more chocolates, sweet foods. Then after each meal we should have to brush. But that's what we are telling. But even though we should have to brush morning and night after sleep, before sleep we should have to 2 times we should have to brush. Then other thing is that you can use some fluoride containing toothpaste. Then other than that, other than brushing, you should have to use floss, because there is chance for accumulation of
floss എന്ന് പറഞ്ഞാൽ
floss means waxed thread that can be used to clean interdental spaces in between the tooth. We cannot brush on go inside.
Food deposition.
We can use the floss and you can remove the food. By that way we can prevent the contact caries, because in between the tooth there is chance for getting caries. That can be prevented. Then other thing, we can use small one tufted brushes, that is interdental brush. That also we can. What the main thing is you should take time and do. You should be careful, because you should not cause any injury to the gums. Then other thing while using the floss is that we should not force the floss in between tight teeth. If they are using like that, means it can cause damage to the gums.
That will lead to the pressure over the gum.
Pressure, because of the pressure, that movement of teeth will come, it will cause damage to the teeth. These are the things. By that, first of all, we should have to we should take care of our tooth. That's the thing. That's the first step we should have to do. Then leave to dental surgeon and other materials. The first one is we only. We should be careful about our tooth. Then others.
Doctor, how long we have to brush? In the sense, like while brushing, how much time we have to brush?
What I told before, time is not a must, but we should brush properly, outside the tooth, inside the tooth, everything. We should brush in front of a mirror, not like sitting somewhere and reading paper, and it's not good.
Just like how you do your shaving.
We should be careful. We should see what we are doing and brush properly.
Okay. Sometimes, doctor, what happens is like sometimes we see blood while brushing.
Okay.
So, can it be a disease or?
Blood while brushing is due to one is due to because of gum problems only it will come. Because of the more accumulation of how the calculus is happening there is means food accumulation will come along with food debris, bacteria, salivary proteins, and everything will come together and they will calcify to form calculus. That is what called calculus. That can cause the first form of calculus is plaque, that is soft deposit only, that we can remove by brushing. If it is changed into calculus, means we cannot remove it by brushing.
Hard deposits,
hard deposit.
Okay.
These hard deposits, if it is there for more time, means it is a colony of bacteria. More than 100 crore bacteria are there in one single drop. That's the main cause for that bacterial accumulation. Because of bacteria accumulation, gingivitis starts. When the gingivitis starts,
gingivitis means inflammation of the gums.
There is a chance for more blood will flow to that area. Because of that thing only, bleeding will come.